Hello, my name is Aaron. I'm going to be taking care of you today. Today we're going to be doing a head, eyes, ears, nose, and throat exam. So first we're going to start with the head. If you could take your hair down for me. Also take a look at that. All right, good deal. So to start off, we're just going to look at the head. We're going to look at the hair first. We notice a full body of hair. It's very silky, very full. What I'm going to do is part the hair, look at the scalp, checking for lesions, for scaliness, dandruff, just anything abnormal. I don't see anything. The scalp is nice and clean. Okay, and then what I'm going to do is just kind of palpate the skull, the contour of the skull, checking for, again, any edema, any lesions. Is there any tenderness anywhere that I'm pressing?
No.
Good, okay. Go to the occipital, just press around here. Okay. So what I'll do next is come around to the front and just look at the facial structure, look at the symmetry of the face, look at your expression. Can you raise your eyebrows for me? Good. Can you frown? Good. Can you smile for me? Okay, good. So sitting here with me has a pleasant affect, appropriate for the situation. What I'm going to do is next is palpate a little bit the sinuses here. Any tenderness, pain?
No.
Good. Okay. Here, skin is intact. It's elastic. There's no issues that I can see here. I'm going to move on to the throat inspection next. Kind of look for the symmetry here. Pull this up and just kind of get a good look here. We'll palpate around a little bit. I'm gonna check these glands here, the submandibular, the submental. I'm just checking for any swelling, any abnormal findings. Good. Can you tilt your head up for me? And can you swallow? Good. Okay. So thyroid, trachea. Everything's midline, no swelling. I'm just going to come the interior approach here, kind of manually maneuver this a little bit. All right, good. So everything's intact there. What we're going to do next is inspect the nose. So I'm going to first I'll just kind of look at the symmetry of it, the patency. I'm just going to palpate a little bit. Anything out of the ordinary there. And it looks like you have a slight deviation to the left. Have you had any previous surgeries or injuries?
Yes, a septoplasty.
Okay, all right. So that would explain the deviated septum there. Other than that, I don't see anything out of the ordinary. Can you tilt your head up again for me? We're going to look at the inside of both nares. Everything looks pink and moist. There's not really any swelling, no exudates. Okay, good. You can bring your head back down. I'm going to do a occlusion test. So what I'm going to do is occlude one nair, and you just breathe through that nostril. Good. And the next one. Okay, good. So no issues there. Next we're going to move on to the mouth. So we'll just look at the lips. Everything's nice pink, no cracking. If you can open wide for me. Good. So we're just looking for pink oral mucosa, any lesions. Tilt your head down for me. Good. Stick your tongue out. Good. Look at the uvula. Everything is intact. Tonsils, no swelling. Tongue is nice and pink, no lesions. Tilt your head back up for me. We're going to look at the teeth, looking for caries, for any dental issues. I don't see anything. Everything looks nice and clean. Okay, you can close for me. All right, very good. What we'll do next is move on to the ears. And I see we're going to do bilateral inspection. On the outside, the auricle, the lobule here, checking for any tenderness, swelling. I don't see anything here. So what we're going to do is do an auditory test. So what I'm going to do is occlude one ear and do a whisper test, and it's going to be a phrase of a couple words, and what I want you to do is repeat those back to me. So we'll include the left
School bus.
Good. I'm going to come and occlude the right ear.
Red Bull.
Okay, good. So hearing is intact. That's just checking for that. Next, I will assess the eyes. So what I'm going to do is back here and look for symmetry there. What I'm going to do is bring this light, checking for pupillary constriction bilaterally. Okay, good. And then I'm going to check for the consensual contraction or constriction of the eye. Okay, good. I will inspect the conjunctiva. So I'm going to just pull down on your eyelid, check the sclera, nice and white. Conjunctiva is nice and pink. And look at the eyelashes. I don't see any issues there. They're nice and full. Same with the eyebrows. What I'm going to do next is do a cover-uncover test. So what this one does is you will cover the right eye, and then I will cover my left eye, and I'm going to bring my hands in like this, and you tell me when you see them with the uncovered eye. So if you go ahead and cover your right eye for me. Good. And then just let me know when you see my hands.
No.
Okay, good. And then cover the left eye. We'll do the same thing. Let me know when you see my hands.
No.
Okay, good. So visual fields are intact. What I'm going to do next is do the extraocular movements. This is a cardinal, the cardinal test, the fields of gaze. So if you could just focus on my finger, and what I want you to do is follow with your eyes. Okay, very good. And then the next one I'll do is checking for accommodation. So if you could focus on my finger, and I'm going to bring it towards your face. Checking for convergence. Okay, very good. And that concludes the assessment. Thank you very much.
Thank you.